is Stephen Girardeau. Were you aware that the average cost of a 3-day stay in a hospital is $30,000? I don't know about you, that's a lot of money. I can't afford that. Today I'll be talking about building a case for why everyone should purchase health insurance. You may be wondering why I'm qualified. I'm not an economist, not a doctor, but I have recently used the healthcare exchange to purchase health insurance, and I've done significant research to prepare for this presentation. Main points I'll be covering today is why you need health insurance, how to get health insurance, and changes the Affordable Care Act has made that has made health coverage even a better deal for the average American. You may be wondering, why is it important for me to have health insurance? A lot of you may be saying, well, I'm healthy, I don't need it. Well, on April 11th, 2014, in an article titled Why I Should Get Health Coverage on healthcare.gov, they detail the cost of some kind of catastrophic stuff that may come up, such as a broken leg costs an average of $7,500. And again, a hospital stay over 3 days takes $30,000. So getting health insurance helps defray the costs of that kind of care and keeps you from ruining your finances. The #1 cause of bankruptcy in the United States is health costs. So another important reason to have health care is, especially now with the ACA, you have preventative care bundled in with your health insurance. Getting a lot of your preventative care handled for free helps you catch problems early. And the earlier you catch them, the less cost it's going to incur for you. So that's great reason to have health insurance. Again, to save money and get the peace of mind of having health insurance. You may be wondering, but how do I get covered? You may not have purchased health insurance before. So the different ways you can be covered is your work may offer a plan through there. It's usually your best bang for your buck. Allows you to have a larger buying pool for that health insurance, keeps your premiums lower. And usually your work is going to help pay that premium, so defray some of those costs for you. If you're under 26, like a lot of my classmates are, that's another great opportunity to get health insurance through your parents' plan. Saves you a little bit of money, might make it even cheaper for your parents that are already paying for your college tuition to keep you covered while you're going through your education. And lastly, on healthcare.gov, in 2013, an article called Get Covered details how you can get covered through the healthcare exchange. They help people find private health insurance, and you may qualify for lower subsidized payments depending on your household size and your income. And you may also qualify for Medicare or CHIP, which is Children's Health Insurance Program. So those are all very realistic options for you to get covered for your health care. And now we're going to go over now that you know how to get your health insurance, let's go over how the Affordable Care Act has helped your health coverage and making your health coverage better. Changes put into effect by the ACA, you're getting a better value out of your health insurance premiums now. They make sure that 80% of your premium goes directly towards health coverage or improving your health coverage. That kind of keeps them from spending more of your premium on marketing or executive compensation. Make sure at least 80 cents on the dollar is going right back into your care. They've increased transparency and health insurance rates. So if you increase your premiums over 10%, if that's what your health insurance company does, they have to provide you with a reason. That may be the ACA itself. Then it's also bundled in free preventative care for your health insurance. So you'll be able to catch problems sooner, and that kind of helps lower costs of healthcare across the United States as a whole, because we're not spending as much on preventing issues once they become big issues. We're kind of catching them ahead of time. And lastly, there is no more denial for pre-existing conditions. 129 million elderly in our country have pre-existing conditions. So now with the ACA, these people can get coverage even if they've maybe lost coverage from previous kind of coverage plan. And you can no longer deny care because of issues like asthma or diabetes. So in conclusion, health insurance is an important decision that requires careful consideration. And now that you have a better idea of what it is and why you need it, I challenge those of you without coverage to invest your time and resources to make this important investment. Thank you for your time.